In this video, I'm going to be talking about artificial airway management with cuff care. Um, when the patient has the tracheostomy in their trach or windpipe, usually through the second or third ring of the tracheostomy in their windpipe or trachea. The tube is placed through the surgical opening that which they had, and once it is in their trachea, it is bypassed in the upper airway, where it is warmed, humidified, and filtering inspired air. Mucus clearance is also another way that well, not mucus clearance, but mucus clearance is also plays a big factor in this as well, because when us respiratory therapists are trying to clear the airways and manage the artificial airway, mucus can build up within the trachea, and we have to be cautious of that when providing care for the patient. And before we do that, us respiratory therapists always wash our hands, hand hygiene before and after providing for the patient, and observe standard precautions to avoid contact with blood or potentially infectious equipment. So we use gloves, mask, to prevent us from any secretions or effective costs that the patient may have. And after we did that, we'll clean the cannula, which we would then take which is performed or maybe changed. The cannula may be changed every 24 to 48 hours, according to the hospital's policy, or however more frequent the necessary needs of the patient and the secretion and size of the tracheostomy. Then we would remove and discard the inner cannula and sterilize it and disinfect it, and replace a new inner cannula. And then we'll go through with the tracheostomy care with that, and then the tube change. With that, we would then inform the patient about procedure after we change the tracheostomy or to change the tube. And then you want to make sure they're being cooperative and enhance the effectiveness in procedure. And then you always want to keep a resuscitation bag with mask near the patient when providing any kind of tracheostomy care prior to cleaning or changing the cannula to decontaminate. And then after that, you want to wash your hands and clean your hands again, and